What I'm about to show you may completely change the way you think about indigestion, bloating, and that heavy feeling after dinner. Because one of the deadliest things about gastric cancer is that it rarely begins with a dramatic collapse. It begins quietly. It begins with symptoms so ordinary, so easy to excuse, that thousands of Americans over 60 brush them aside until the disease has already moved further than anyone realizes. I'm Dr. Michael Joel, and today I need you to stay with me all the way to the end, because what looks like simple heartburn can, in some cases, be the warning your body has been trying to give you for months. Please subscribe today, tap the bell, and join our channel for clear health guidance that protects your future and family. Now, before we go any further, I need you to understand something that most people never hear clearly enough. Gastric cancer, which is what many doctors call stomach cancer, is not always loud in the beginning. It doesn't always announce itself with severe pain or obvious bleeding. In fact, one of the reasons it becomes so dangerous is because it often hides behind common digestive complaints that seniors have been taught to tolerate. Feeling full too fast, losing interest in food, mild nausea, a little pressure in the upper belly, a bit more fatigue than usual. And because those symptoms can overlap with reflux, gastritis, ulcers, medication side effects, or simply aging, people convince themselves it can't be serious. That is exactly why this conversation matters. The earlier stomach cancer is found, the more options people usually have. The longer it's ignored, the harder the road often becomes. Let me tell you about Walter from Columbus, Ohio, because his story reveals why this disease slips past so many good, careful people. Walter was 72, retired from the Postal Service, organized, dependable, and not the kind of man who ignored his health. But for nearly 4 months, he kept noticing that he felt unusually full after small meals. Half a turkey sandwich and he was done. A few bites of eggs in the morning and he felt pressure in his upper abdomen. He told himself it was age. Then he decided it was stress. Then he blamed the spicy chili he loved on Sundays. And because the discomfort came and went, he treated it like a nuisance instead of a warning. By the time he saw a doctor, he had also started losing weight without trying. That was the moment everything changed, because the small things had not been small at all. Here's the part that concerns me most for older viewers. Gastric cancer often develops when cells in the stomach lining are injured over time and begin changing in ways they should not. Those cells start multiplying when they're not supposed to, and eventually they can form a tumor. But unlike a broken bone, unlike a stroke, unlike chest pain that forces immediate attention, stomach cancer can drift into your life with symptoms that seem almost too ordinary to take seriously. And that is why seniors are especially vulnerable. When you've lived long enough, you've had indigestion, nausea, and appetite changes before. You've had medications upset your stomach. You've had nights where dinner just didn't sit right. So when something dangerous starts softly, it can easily be filed away as just another digestive issue. That false reassurance is where time gets lost. So let's start with one of the most overlooked early clues. And this one matters more than people realize. Feeling full after eating only a small amount of food. I'm not talking about Thanksgiving dinner. I'm talking about a few bites of chicken, a small bowl of oatmeal, half a baked potato, and suddenly you feel like you cannot take one more bite. That sensation, especially when it becomes a pattern, can happen because a tumor is affecting how the stomach stretches, empties, or handles food. Linda, a 69-year-old grandmother from Des Moines, noticed this first at breakfast. She used to enjoy toast, fruit, and coffee. Then she could barely finish a few spoonfuls of yogurt. She thought she was just eating less because she was getting older, but over time she also stopped feeling naturally hungry, and that combination deserves attention. Early fullness that persists is never something I want seniors dismissing. The next warning sign is persistent indigestion or heartburn that feels different from your usual pattern. Now that word different is important because many older adults already live with reflux or occasional burning after meals. I'm not asking you to panic over one uncomfortable night after pizza. I'm asking you to notice change. Is the indigestion happening more often than it used to? Is it lasting longer? Is it showing up even when you eat bland foods? Does it come with pressure, nausea, or a sense that food just sits there? Robert from Tampa had lived with heartburn for years, so when his symptoms started getting more frequent, he just bought stronger over-the-counter remedies. That calmed him down for a while, but it also delayed evaluation. If your usual heartburn suddenly becomes stubborn, heavier, or paired with appetite loss or weight loss, that is not a symptom to keep negotiating with in silence. Now let's talk about bloating and upper belly discomfort, because this is another place where gastric cancer can hide in plain sight. Many seniors describe it as pressure under the ribs, a nagging ache in the center of the abdomen, or the uncomfortable sensation that food is just sitting there for too long. And sometimes the discomfort isn't even severe. That's what makes it deceptive. It can be vague. It can come and go. It can feel like gas, like slow digestion, like something that should pass on its own. Elaine from Pittsburgh started unbuttoning her slacks after lunch because she felt swollen and tight in her upper belly almost every afternoon. She assumed it was beans, bread, or getting older. But when bloating becomes regular, especially when paired with nausea, poor appetite, or early fullness, it stops being a minor annoyance and starts becoming a pattern your doctor needs to hear about. Then there's nausea and vomiting, and I need to be careful here because these symptoms can come from 100 different things. Medication side effects, infections, food poisoning, ulcers, gallbladder trouble, even anxiety. But when nausea becomes a recurring part of your daily life, especially in an older adult who wasn't normally dealing with it before, I want that taken seriously. If vomiting starts showing up repeatedly, that concern becomes even more urgent. Sometimes a stomach tumor can interfere with how food moves through the stomach, causing backup, irritation, or obstruction. And if there is blood in the vomit, or if the stool turns black and tarry, those are red flag signs that need immediate medical evaluation. Harold from Tulsa thought his dark stool was caused by a supplement. It wasn't. Bleeding somewhere in the digestive tract can show up this way, and stomach cancer is one possible cause that doctors must rule out quickly. Another major warning sign is unexplained weight loss, and this is one of the symptoms that should always slow you down and make you pay attention. I'm not talking about cutting desserts and losing 6 pounds over a summer. I'm talking about weight dropping without effort, clothing getting loose, family members telling you your face looks thinner, and you not really having a good explanation. Sometimes that happens because people with gastric cancer lose interest in food or feel full too quickly. Sometimes it happens because the body's metabolism shifts in response to cancer itself. And very often, it comes with fatigue, not ordinary tiredness after a busy day. I mean, the kind of weakness that lingers, the kind of exhaustion that makes grocery shopping feel like a major task. If you're losing weight, eating less, and feeling unusually drained, that combination should not be normalized just because you're over 60. Now let's move into symptoms that often suggest the disease may be further along, because this is where urgency really matters. Trouble swallowing can happen, especially when the cancer is located near the upper part of the stomach where it meets the esophagus. Food may feel slow going down, or it may seem to stick. Belly pain may become more persistent. And in more advanced cases, people can develop jaundice, where the skin or the whites of the eyes look yellow, or ascites, where fluid builds up in the abdomen and creates visible swelling. These are not subtle symptoms. These are signs that the body may be under significant strain. And the tragedy is that many people only seek help once symptoms become this obvious. I don't want that for you or your family. The goal is not to wait until things look dramatic. The goal is to respect the smaller warnings before they evolve into bigger ones. So what causes gastric cancer in the first place? That's where we need to separate myth from medicine. The exact starting point in one person is not always easy to identify, but the overall picture is this. Something damages the inner lining of the stomach over time, and those repeated injuries can lead to abnormal cell changes. And once the DNA inside those cells begins changing in the wrong way, the normal controls that tell cells when to grow and when to die can start failing. That's how tumors form. But this doesn't usually happen out of nowhere. There are risk factors, there are patterns, there are conditions that raise the odds. And understanding those risk factors doesn't mean you should live in fear. It means you become harder to fool. You become less likely to dismiss symptoms if you know you already carry some of the background conditions that make stomach cancer more likely. One of the most important risk factors is infection with a bacterium called H. pylori. This is a germ that can live in the stomach lining and, in some people, create long-term inflammation. That chronic irritation can set the stage for ulcers, changes in the stomach lining, and over many years, a higher risk of cancer. Now here's the frustrating part. Many people with H. pylori never know they have it. They may have no clear symptoms, or they may just have vague stomach discomfort off and on. Sandra from Lexington had years of sensitive stomach symptoms that she managed with antacids and crackers. What nobody realized at first was that an untreated infection had been causing deeper damage over time. And this is why older adults with persistent upper abdominal symptoms should sometimes ask whether testing makes sense. Treating an infection early is not a guarantee against cancer, but ignoring long-term inflammation is never a wise strategy. Smoking is another important risk factor, and I need to say this plainly. Many viewers already know smoking harms the lungs and heart, but fewer people understand that it also increases the risk of stomach cancer. The chemicals in tobacco don't only damage one organ system, they affect the whole body. They contribute to inflammation, cellular injury, poor healing, and cancer risk in multiple places. I've had patients tell me, "Doctor, I quit 20 years ago, so that old history doesn't matter now." And quitting absolutely helps. It helps more than you know. But a long smoking history still belongs in the risk picture, especially if symptoms are starting to emerge. This is not about guilt. It's about honesty. If you smoked for decades and now you're dealing with ongoing indigestion, appetite loss, or weight loss, your doctor needs that full story. Your past exposures still help explain what your present body may be doing. Diet matters too, and this is one of those uncomfortable truths that gets buried under trendy nutrition advice. Over many years, diets heavy in salted foods, smoked foods, and heavily preserved foods have been linked with higher stomach cancer risk. That doesn't mean one serving of ham or smoked sausage is going to cause cancer. It means patterns matter. Repetition matters. What you expose your stomach lining to over decades can matter. Meanwhile, excess body weight may also raise risk in some stomach cancer patterns, especially around the upper stomach area near the esophagus. And that's why I want seniors to think in terms of long-range habits, not perfection. More fresh foods, more fruits and vegetables when possible, less dependence on the salty, shelf-stable comfort foods that became routine in many American households over the years. The stomach remembers what it is exposed to, and long-term patterns can quietly shape long-term outcomes. There are also medical conditions that can increase risk, and this is where some viewers need to pay very close attention. Chronic inflammation of the stomach lining, certain stomach polyps, pernicious anemia, a history of partial stomach surgery, and long-standing problems involving the upper digestive tract can all change the environment inside the stomach. In some people, those changes make abnormal cell growth more likely. If you've been told you have chronic gastritis, intestinal metaplasia, or another condition affecting the stomach lining, that history matters. It doesn't mean you will get cancer. It means you should be more alert, not less. And when symptoms shift, especially if you are over 60, the threshold for getting evaluated should be lower. I have seen too many people assume that because they already had a stomach problem, every new symptom must be part of the old problem. Sometimes it is. Sometimes it absolutely is not. Family history matters as well. And this is another detail people often keep tucked away in the back of their minds instead of bringing it forward where it belongs. If a parent, sibling, or several close relatives had stomach cancer, that does not guarantee you'll face the same diagnosis. But it does raise concern, especially if symptoms appear. There are also rare inherited syndromes that can increase risk substantially. Most people do not have those syndromes, but when cancer seems to run through a family in unusual patterns, doctors need to know. Michelle from St. Louis almost didn't mention that both her father and aunt had stomach cancer because she assumed it was just one of those things. But that family history changed the level of urgency around her workup. Never edit your story to make it seem less serious. If cancer lives anywhere in your family tree, your doctors deserve the full picture. Now let me tell you who should be extra alert, because this disease does not affect everyone equally. Stomach cancer is more common in older adults, and the average age at diagnosis in the United States is around the late 60s. Men are affected more often than women. And many of the risk factors we just discussed become more important as the years pass because damage has had longer to accumulate. That is exactly why this message is so important for viewers over 60. If you are in your late 60s, 70s, or beyond, and you notice a persistent change in appetite, digestion, weight, or energy, you do not need to prove catastrophe before calling your doctor. And please hear me on this. I am not telling you to assume the worst. I am telling you not to assume the best without evidence. Calm attention saves people. Denial does not. So when should you actually call a doctor? This is the practical question, and I want to make it simple. If you have ongoing indigestion, persistent bloating, nausea, loss of appetite, early fullness, stomach discomfort, or unexplained fatigue that lasts more than a couple of weeks, it is time to make contact. If you are losing weight without trying, seeing black stools, vomiting repeatedly, noticing trouble swallowing, or seeing blood, that moves from make an appointment into get evaluated promptly. Write the symptoms down. Write when they started. Write how often they happen. Write whether they are linked to meals and whether they are getting worse. Because one of the fastest ways to help a doctor help you is to show a clear pattern instead of a foggy memory. A few well-kept notes can make the difference between let's watch this and we need to investigate now. And when doctors investigate, the test that often matters most is the upper endoscopy. This is the moment many people fear, but I want to make it less mysterious. An endoscopy uses a thin, flexible tube with a camera to look inside the upper digestive tract. It allows the specialist to directly see the lining of the esophagus, stomach, and first part of the small intestine. And if something suspicious is seen, tiny samples can be taken right then. That tissue sample, called a biopsy, is what tells doctors whether cancer is present. Not symptoms alone, not a guess, not a hunch. The biopsy matters because it turns suspicion into an answer. And for seniors, that answer matters even if it turns out not to be cancer. Ulcers, inflammation, and other conditions can also cause these symptoms, and they deserve treatment too. The point is clarity. Uncertainty is exhausting. Evaluation gives you a direction. If cancer is found, the next question is stage, and this is where many families feel overwhelmed. Staging simply means figuring out how far the cancer has grown and whether it has spread. Doctors may use CT scans, special ultrasound during endoscopy, blood work, and sometimes additional procedures to understand the full picture. Has the tumor stayed in the stomach lining? Has it grown deeper into the wall? Has it reached nearby lymph nodes? Has it spread to other organs? Those questions guide treatment, and without staging, it is impossible to make a smart plan. I always tell patients this: stage is not a moral verdict. It is not a measure of whether you were good or bad at catching it. It is a map. And once you have a map, you can stop imagining 10,000 terrible possibilities and start dealing with the actual road in front of you. Now, here's the part I want every viewer to hear carefully. Treatment for gastric cancer is not one size fits all. There isn't one universal path. The plan depends on where the tumor is, how deep it is, whether lymph nodes are involved, whether the cancer has spread, and how strong the patient is overall. Age matters, but health matters even more. Some 78-year-olds are physiologically stronger than some 62-year-olds. That's why good cancer care looks at the whole person, not just the birth certificate. And the encouraging truth is that treatment has become more personalized. Surgery, chemotherapy, radiation, targeted drugs, immunotherapy, nutrition support, and symptom relief all have roles depending on the case. The worst mistake is to hear the word stomach cancer and assume there is no hope. Hope changes shape from person to person, but it absolutely still belongs in this conversation. Let's start with the earliest stage, because this is where catching the disease sooner can change everything. When a cancer is found very early and limited to the inner lining, some patients may be treated through the endoscope itself without a major open surgery right away. In selected cases, doctors can remove the abnormal tissue directly during a specialized endoscopic procedure, and that can mean less recovery time and a more targeted approach when the disease truly has not spread deeply. Not everyone qualifies for this. The tumor has to meet certain conditions, but this is exactly why I keep coming back to the same message. Earlier evaluation creates possibilities. Delay closes them. And when seniors tell me, I didn't want to bother anyone over a little indigestion, this is what I think about. That little symptom may be the dividing line between a smaller intervention and a much more difficult journey months later. When surgery is needed, the goal is usually to remove the cancer along with nearby lymph nodes. Depending on where the tumor sits, surgeons may remove part of the stomach, called a subtotal gastrectomy, or sometimes the entire stomach, called a total gastrectomy. I know that sounds terrifying, and it's okay if hearing those words makes your heart race a little, but modern surgical planning is far more thoughtful than many people realize. The team considers nutrition, recovery, swallowing, weight maintenance, and overall strength before and after the operation. After a partial surgery, the digestive system is reconnected so food can still move through. After a total gastrectomy, the esophagus is connected to the small intestine. And yes, life changes after surgery. Eating changes. Meal sizes change, but many patients do adapt, especially when they have strong nutritional guidance and follow-up. Chemotherapy is another major part of treatment, and I want to explain it in a way that feels practical instead of abstract. Chemotherapy uses medicine to attack cancer cells throughout the body. Sometimes it is given before surgery to shrink the tumor and improve the chance of removing it successfully. Sometimes it is given after surgery to reduce the risk of the cancer coming back. And in some cases, it is combined with radiation, a strategy called chemoradiation. Now, many older adults hear chemotherapy and immediately picture nonstop suffering. But the truth is more nuanced. Side effects are real, yes. Fatigue, nausea, appetite changes, infection risk, and weakness can all happen. But supportive care has improved. Anti-nausea medications are better. Hydration plans are better. Dose adjustments can be made. The experience is not easy, but it is also not identical for every person, and fear should never replace information. Radiation therapy may also be part of the plan, especially in certain settings where doctors want to target the area around the tumor or reduce the chance of local recurrence. Radiation uses high-energy beams to damage cancer cells so they cannot keep multiplying. And when it is combined with chemotherapy, the goal is often to make treatment more effective in controlling disease in a specific region. For some patients, radiation is used before surgery. For others, it comes afterward. For some people with advanced disease, it may also help relieve symptoms such as bleeding or pain. And this is why a multidisciplinary team matters so much. Surgeons, medical oncologists, radiation oncologists, gastroenterologists, dietitians, and nurses all bring something different to the table. Stomach cancer is not the kind of disease where one doctor should be carrying the entire burden of decision-making alone. Good care is coordinated care. Now let's talk about newer treatments, because this is where many families find a little breathing room after the shock of diagnosis. Some stomach cancers have specific molecular features that allow doctors to use targeted therapy, drugs designed to attack certain signals the cancer depends on. Others may respond to immunotherapy, treatment that helps the immune system recognize and fight cancer more effectively. And these are not miracle buttons. They do not work for every patient. But for the right person, they can meaningfully change the treatment landscape. This is one reason biopsy tissue may be tested further after diagnosis. The cancer is not just identified. It is profiled. Doctors want to know what kind of tumor they are dealing with. And that matters because cancer care is becoming less generic and more individualized. If you or someone you love is diagnosed, ask what testing has been done on the tumor. That question can open doors. There's another form of treatment people don't talk about enough, and that is palliative care. I want to say this slowly because too many families hear the phrase and assume it means giving up. It does not. Palliative care is specialized support for symptoms, comfort, strength, nutrition, sleep, stress, pain, nausea, and quality of life. It can be used alongside active cancer treatment. In fact, the earlier it is involved, the more it can help. Stomach cancer often affects eating, weight, and energy in ways that can wear people down quickly. A patient who is nauseated, dehydrated, frightened, and barely eating is going to struggle more with everything. And that is why supportive care is not a side issue. It is part of the treatment. A strong care team is not just trying to fight the cancer. It is trying to protect the person living inside the cancer story. Nutrition deserves its own moment here because the stomach is at the center of eating. And when cancer or treatment disrupts that process, life changes fast. People may need smaller meals, softer foods, more protein, calorie-dense snacks, supplements, or careful hydration planning. After stomach surgery especially, eating patterns often need to be relearned. Some people do better with 6 small meals. Some need help avoiding dumping symptoms where food moves too quickly and causes weakness, sweating, or cramping. And this is where family support becomes powerful. The spouse who helps track meals, the daughter who brings easy-to-tolerate foods, the grandson who drives to appointments. Medical treatment is critical, yes. But so much of cancer care also happens in kitchens, living rooms, and quiet car rides home. Seniors do not just need medications. They need a circle of practical support that helps them keep their footing when the ground starts shifting. Let me tell you about George from Phoenix because I want you to hear a story that holds both fear and hope at the same time. George was 74 and almost didn't go in. He had early fullness, mild nausea, and a vague pressure under his breastbone that he blamed on coffee and late-night sandwiches. His wife kept insisting something was off. He kept saying it would pass. Then he started dropping weight. Not a little, 15 pounds in a few months, and that finally got his attention. His evaluation showed stomach cancer. The news hit like a truck, of course it did. But because he finally came in when the pattern became undeniable, he still had meaningful treatment options. He went through a carefully planned combination of therapy and surgery. It wasn't easy, but he kept saying the same thing later. The hardest part wasn't treatment. The hardest part was knowing he almost waited longer. And that is exactly what I need this video to do for you today. I do not want to make you terrified of every stomach ache. I want to make you wiser about patterns. If you have one random episode of indigestion after a greasy meal, fine. If you have months of appetite loss, bloating, fatigue, or unexplained weight loss, that is different. If you keep getting full after just a few bites, that is different. If you see black stools or vomit blood, that is different. And if something in your body feels changed in a way that keeps repeating, you are not being dramatic by getting it checked. You are being responsible. You are doing what smart adults do when the body stops behaving like itself. And for viewers over 60, that kind of attention can be life-saving because stomach cancer often depends on being underestimated. So here is the practical plan I want you to remember. First, do not self-diagnose, but do not self-dismiss either. Second, write down persistent symptoms and bring that record to your doctor. Third, if symptoms are ongoing or escalating, ask whether you need a gastroenterology evaluation. Fourth, if you have risk factors like H. pylori, smoking history, chronic stomach problems, or family history, say that out loud. And fifth, if you are diagnosed, remember that treatment planning is a process, not a single terrifying moment. Ask what stage it is, ask what the goals are, ask whether surgery, chemotherapy, radiation, targeted therapy, or immunotherapy fit your case. Ask what can help with eating and strength. And above all, do not try to carry the entire emotional burden in silence. Bring someone with you. A second set of ears can make a frightening room feel much more manageable. I also need to say something to the family members watching, because many of you are the first ones who notice change. You're the daughter who sees your mother pushing food around the plate. You're the husband who notices your wife's pants hanging looser than usual. You're the friend who hears someone say for the fourth week in a row, "I just don't feel hungry anymore." Trust those observations, and don't let politeness become passivity. Sometimes the kindest thing you can do is say, "This has been going on too long. Let's make the call." Older adults are often reluctant to complain. They don't want to be a burden. They don't want more tests. They don't want bad news. But avoiding evaluation does not protect peace. It often just postpones truth. Loving someone means helping them face what needs to be faced, while it is still more manageable. Before we finish, I want to bring this back to where we started. Gastric cancer is dangerous not only because it can be aggressive, but because it can sound ordinary in the beginning. It borrows the language of common digestion problems. It hides behind bloating, heartburn, early fullness, nausea, and fatigue. And that disguises what gives it time. Your job now is not to become frightened of every symptom. Your job is to become harder to fool. Notice patterns. Respect change. Don't let persistent symptoms talk you into complacency. And if the body is whispering the same message over and over, do not wait for it to start screaming. That is the heart of awareness, not panic, not obsession. Awareness means recognizing that your body may be asking for help before the emergency ever arrives. The sooner you listen, the more choices you often preserve. If this video helped you understand stomach cancer in a clearer, calmer, more practical way, then share it with someone over 60 who needs to hear it. And if you've been brushing off symptoms because you thought they were too small to matter, let today be the day you stop guessing and start paying attention. Your health is too important for silent assumptions. Your future is too valuable for delayed answers. And whether the issue turns out to be cancer, an ulcer, reflux, or something far more treatable, getting clarity is always better than living in uncertainty. I'm Dr. Michael Joel. Take care of yourself, protect the people you love, and I'll see you in the next video.